October 13th is marked as World Thrombosis Day to increase awareness of blood clots, which are one of the most common preventable cause of death, especially in hospitalized patients. On that account, today we will discuss about thrombosis and how to get solutions for this deadly blood condition from our esteemed guest, Dr. Satish Katula. Dr. Katula is a clinical professor of medicine, hematologist, and oncologist, and president-elect of API, that is American Association of Physicians of Indian Origin. So let's welcome our esteemed guest, Dr. Satish Katula. Dr. Katula, how are you doing today?
I'm doing good. Namaste.
Thank you so much for being on our show. So, firstly, I'll go into this question straight away, Dr. Katula. Tell our audience, generally, what is thrombosis and why do we need awareness regarding this condition?
So thrombosis is basically blood clots. So the blood clots can form in arterial blood or venous blood. So and they can be very deadly, either arterial or venous. And venous clots tend to be more common than arterial
Mm,
because there is a venous, flow which is passive, whereas arterial flow is like your heart pumps and there is a pressure to it.
mm,
And even if you are not moving around, the arterial, blood flows because of the heart is pumping all the time.
right.
The venous blood has to passively go against the gravity, especially from the lower, extremities or legs
Mm,
towards the heart. So for that, there's a passive mechanism, and that's why the venous blood has more chance of getting blood clots. So, how does it happen? Basically, in our body, the blood is in fluid state because there are factors that promote blood clotting. There are certain factors that actually prevent blood clotting. So,
mhm,
the first ones are called procoagulants,
mhm.
second ones are called anticoagulants. And there is a perfect balance in our blood, and that's what keeps our blood in fluid state.
Right.
So if we have more coagulants or less anticoagulants, then the balance is lost, and that's when people have blood clots. So there are so many things. The venous blood clots, when you talk about it, there's so many risk factors. For example, the venous blood, can be due to prolonged immobility, where people are not moving around after hospitalizations or after surgeries, after prolonged travel. For example, people who are flying or people who are driving, they are not really moving around and there is no good circulation. So the venous blood kind of stagnates. If there's inflammation in the lining of the blood vessels, inner lining, it's called endothelium. If there's any damage to that, or if there is any inflammation, or if there is venous stasis, what that means is pooling of the blood. So all these things can lead to blood clots. And as I mentioned, not moving around is a very common cause, especially in hospitalized patients or after surgeries, after travel. So patients who smoke, who are obese, who are taking birth control pills, pregnant women, all these, also get blood clots more easily than others. Certain types of cancers can also promote blood clots. So these are all the things that can cause. So that's why one should be very aware about this condition. Yeah.
I read this part. Thank you so much, Dr. Katula, for for enlightening our audience about thrombosis and the blood clots and what the type of blood clots as well. I wanted to ask that question to answer me, so that'll make my thing more easy. So, wanted to touch base about tell our audience, give our audience a rough estimate or some statistics of thrombosis and who are actually suffering from this particular condition.
Sure. About 400,000 people in the US
Hmm.
and about 10 million people worldwide develop blood clots every year, which is a staggering number, actually.
Hmm.
And one in four deaths are felt to be due to blood clots. And about 60% of the venous blood clots are related to hospitalization. They occur either during hospitalization or immediately after hospitalization. So, and it is very preventable. And about $10 billion are spent on the treatment and prevention of blood clots every year in the US. And when you look at worldwide, it's even much more. So those are the statistics roughly.
Thank you so much. That's really helpful. And now that we know the statistics and now that we know what it is, tell us about the risk factors. How can it affect an individual, or rather, how fatal can thrombosis become?
So there are risk factors, as I mentioned before. They can be hereditary, which is about 10 to 20% of patients. When you take 100 patients with blood clots, about 10 to 20% of them are born with certain defects. That's one thing. And then the more common cause is acquired causes. So
Hmm.
under acquired causes, you have so many factors. For example, prolonged immobility, meaning that people who are not moving around. So, for example, people who are hospitalized, people who undergo surgery, people who are sick, like with paralysis and not moving around,
Right.
bedbound, elderly people, and traveling in car or flight, that can also cause blood clots. And there are several other risk factors. For example, being overweight or obese can increase
Right.
the risk of blood clots. Smoking can make blood more sticky, and that can cause blood clots, either arterial or venous. And then birth control pills, pregnancy, and certain types of cancers can actually increase the chance of blood clots. And how fatal they are very fatal sometimes, especially the venous blood clots when they go to lungs. It's called pulmonary embolism. Basically, the clots break loose and they travel upwards towards the lungs and they block the flow to the lungs, and people become short of breath and they have
Hmm.
chest pain and things like that. So that really causes a lot of symptoms, and sometimes they may not be symptomatic. Sometimes sudden death can happen if the clot is really big and it is blocking all the flow to the lungs.
Correct.
People die instantly, and I've seen those too. So yeah, it is a potentially fatal type of disease. That's why it's very important to prevent and treat blood clots.
Okay. So while you were talking about the risk factors and how fatal it can become, this question crossed my mind. I feel it can be beneficial to our audience too. Can any chronic conditions like diabetes or hypertension, something like that, can that also trigger blood clots in general?
Yeah, I mean, they can cause what is called atherosclerosis. That is basically hardening of the arteries,
Hmm.
more than blood clots. But when some people have, atherosclerosis of the arteries, they can have blood clots such as strokes. Those are, small, clots that break loose and go to the brain, which can cause, stroke. And those are, risk factors for strokes and heart disease or heart attacks and things like that. Or sometimes people have lack of blood supply to the legs, and they may have gangrene and all that, which can be seen with diabetes and hypertension, high cholesterol, and things like that. Uh,
Right.
when we talk about clots, we're talking about venous clots, which
Right.
are preventable. Even arterial clots can be prevented too, especially when we risk modify, meaning that if people stop smoking, if people have good control of their diabetes, their hypertension, high cholesterol, I mean, that can prevent arterial clots too.
Thank you so much, Dr. Katula. So now that we know all the risk factors, now that we know, fundamentally what it is, as we have discussed, the most important thing I feel is prevention and treatment. So tell our audience, enlighten our audience about prevention and the treatment procedures and processes for thrombosis.
So, so prevention is very, very important because that can prevent a lot of deaths and morbidity,
Hmm.
especially hospitalized patients. What we do is we give them blood thinners as prophylaxis, and we encourage them to move around. And
Right.
also, people who undergo surgery, we ask them to move as much as possible. And if they have other risk factors, we put them on prophylactic blood thinners to prevent blood clots. And people who are sick, we try to tell them to move around as much as they can, walk as much as they can. So early ambulation is very, very important. And what else can we do to prevent? For example, people who are traveling. That's why in flights you see they give you some simple exercises to keep the blood flowing, so it won't form a clot. So things like that, small exercises when you're sitting, rotating your feet, and getting up frequently every hour or two, and walking around when you're flying or when you're driving. And these are all very important things to remember. Pregnant ladies, we have to encourage them as much as possible to move around. And birth control pills, if they can avoid, that'd be good. Like instead of taking pills which are high in estrogen, progesterone, then if we recommend them IUDs, the risk of blood clots is less. And the people who are obese, they have to lose weight and maintain normal BMI to reduce the chance of blood clots. And smoking actually is also a risk factor, as I mentioned before. And we have to strongly encourage patients to quit smoking, which can reduce the risk of blood clots. And other things like cancers, especially blood clots occur in advanced cancer patients. So for that, when we treat and sometimes we give prophylactic, anticoagulation or blood thinners for patients who are not moving around and things like that. But cancer is something that we have to treat the underlying cause, basically to prevent blood clots and things like that. So these are all the preventive measures. Definitely, we can, and there are a lot of hospitals very, strict about, following the protocol of giving everybody prophylactic blood thinners to prevent clots. And how do we treat the blood clots? Basically, giving IV heparin, what we call, or Lovenox, which are injections. And nowadays, we are treating majority of the blood clots with oral blood thinners. There are some, things called apixaban, rivaroxaban. These things can actually prevent blood clots. And some people are on them for about 3 to 6 months. But some, they have risk factors which are non-modifiable. Then we put them on blood thinners for long term. Like some people are on blood thinners, lifetime, to prevent any deaths and things like that, any morbidity. So that's why, we have to treat, it's on an individual basis, what kind of treatment and how many days we are going to treat. So that's when we come in as hematologists, as blood specialists, we recommend, based on the patient's characteristics.
Thank you so much, Dr. Katula. That was really, really helpful, and I'm very sure our Mana TV international audience are taking notes, and they're getting benefited by the wonderful advice you're giving. So we're almost at the end of our show. Once again, I thank you for coming to the show and giving us these wonderful details and suggestions. Any message to any collective message to our audience, so that they can become more aware, they can become you know worry free.
Yeah, thank you, Sharad Garu, for the opportunity. And I always love to come and educate the audiences through multiple channels and
Absolutely.
media. So it is definitely needed because people have to be aware of these things. And when they see thrombosis, a lot of people are not aware, but they do not have medical knowledge, understandably. But the message is basically, move, and move, because that's a simple thing people can do. If they get sick, instead of sitting, or instead of laying in the bed, one has to get up and move frequently. That actually can help with the blood flow, blood circulation, and that can prevent blood clots. And if you have any other risk factors, you need to talk to your doctor. And if you have anything, like swelling of your leg, or pain, redness, or chest pain, shortness of breath, consult your doctor immediately. So if you have bad, habits, quit them, such as smoking. If you're overweight, as I mentioned before, lose weight. But If I have to give one message to everybody, a common one, move, move, and move. Thank you.
Wonderful, wonderful, wonderful. So that should become the movement to move always. So definitely we'll take the wonderful words of our wonderful guest, Dr. Satish Katula. Thank you so much once
Thank
again.
you. Thank you
So
so much.
thank
Thanks.
you. So, friends, that was about World Thrombosis Day, that is October 13th, and the lovely words of Dr. Katula are here for you to jot down notes and enjoy this session and become more aware about thrombosis. I hope you liked it, and please share your comments uh, on the email that is flashing on the screen, and follow our YouTube and Facebook page, that is Mana TV. See you again. Thank you.